In this video, we'll talk about proper communication techniques with patients who suffer from primary pain. Individuals who suffer from primary pain often have had experiences where they've been told that your pain is all in your head, and because of that, anxiety and stress was created around it that was not conducive to proper outcomes and recoveries. We need to treat our patients with dignity and respect, validation that this is now a bona fide scientific and evidence-based diagnosis, so we could give proper management and rebuild the trust in the therapeutic alliance between our patients and ourselves.
So I often will start though with a patient by telling them, "I'm so glad you're here. This is great that you showed up with this problem," because there's a ton of new neuroscience that tells us why people often have problems that are so difficult to get better, why people have problems that have been treated and won't resolve. There's a lot of new scientific information about this in the last few years and some new treatment models. So I'm super glad you showed up here because I think there's something we can do about this.
I really think that you have to start as a physician from the perspective of, quote unquote, believing the pain, validating the pain, and showing empathy for the pain to diminish that risk that they're going to hear that age-old understanding that it's all in my head.
What I say to them at the top is that anybody who says that the pain is all in your head is being either not understanding pain, being dismissive, being judgmental, sometimes being downright cruel. And it's not the case. Your pain is real. All pain is real. And I know that you've been suffering with it. It's not because you're crazy. It's not all in your head. It's not that you want the pain. It's not your fault. None of that is true.
And then I often like to tell people it's a very common problem. They may say, really? Well, nobody else seemed to think so. But what's a common problem is people walking into a primary care office who have seen a bunch of other doctors and nobody's come up with a satisfactory explanation or a satisfactory treatment plan. This is super common. And depending on what type of practice you have, it might vary. But for many docs, it's several times a day. Somebody rolls in, they've seen a bunch of specialists who haven't quite put a finger on something, but all the tests have been done, the due diligence has been done. So I like to tell people, oh, you have a common problem.
There's new information and there's new knowledge about pain that many doctors don't really know yet. And it comes from the neuroscience of predictive processing in the brain.
Pain is a danger signal, and unlike what a lot of people believe, pain is always created in the brain.
Our bodies will get injured, and those injuries will be painful, and then the injuries will heal. And in some cases, however, the pain can persist after the injuries have healed. This is due to changes in brain pathways that cause the pain to persist after the injury has healed.
There is emergent science that is actually providing a lot of the functional insights behind primary pain, including functional MRI, which show very high activation of the pain matrix, misfiring of neural networks that are involved in pain manifestation and pain sustenance and chronification of pain. There are also EEG, corticography, tractography types of studies that show these functional impairments as well.
And then finally, if there's some obvious anxiety and a patient is aware of it, has even brought up anxiety, I sometimes talk to them about how, well, you know how that anxiety keeps you like this a lot of the time? That's your autonomic nervous system. That's what makes us anxious, sending out the fight or flight response. I think your autonomic nervous system has hijacked you. And it sends a lot of warning signs, including pain. Pain's a protective mechanism, and it's sending out that signal, but doesn't really need to.
When this happens, it's really good news because those brain pathways are plastic, and when the pain has been learned, it can be unlearned as well.
It may be that the characteristics of your pain fit into a category where we can actually turn it around, where we can make it go away. I've seen people just like you who've gotten better, who've actually really gotten better, not just had to cope with their pain and put up with it and try to manage it.
It's finally the time to recognize that primary pain is a bona fide disorder. It has made its way into our international classifications. It is scientifically and clinically evidence guideline-based diagnosis, and the management and interventional approaches are very robust and effective, safe and tolerable. This is going to return power back to the patients that otherwise have been gone through the ringer of doctor to doctor, handoff after handoff, and finally see a bright future, which could be a functional future for primary pain patients.